Hi, I'm Dr. Dutson, and first I'd like to thank you for visiting my website and watching this short video. The website's main mission is about giving you the latest medical research on diabetes, and it's also about giving you information on all aspects of reversing type 2 diabetes. Because you see that the dialogue really should change in the diabetic world. Because all you hear about right now is you hear about living with diabetes. And what we really should be talking about is reversing diabetes. Because the medical literature is very clear is that the majority of type 2 diabetes is in fact reversible. And I'm absolutely passionate. I want to give you this information and so that you have the tools so that you can start doing just that, reversing type 2 diabetes. Now, the first thing I'd like to encourage you to do is I'd like you to sign up for my free ebook. It's entitled Understanding How You Became Insulin Resistant. It's important that you understand how you got here, and then it starts to make more sense how you can start reversing that process. And in addition, what you'll get by signing up is you'll start getting regular updates on real-world steps on how you go about reversing diabetes. I'd also like you to remember is that life doesn't get better by chance, life gets better by change. And I'd like to encourage you to start making that change. And I'm here to help you make that change so that you can stop living with diabetes, and in fact you can start living without diabetes. Over the years, I've had a handful of friends and immediate family members that have had diabetes, so I've had that firsthand experience. But my first experience with diabetes was with my grandfather. As a child growing up in Idaho, we used to go fishing a lot, and we had a great time fishing with fly fishing in some of the streams up there. And unfortunately, though, that was cut short because of my grandfather's progressing diabetes. He started having wounds that wouldn't heal. He had a couple instances where, quite frankly, he almost drowned because of the diabetes causing him to go into a coma, and he ended up in the water. And because of these instances and wounds when he would scrape up on the rocks that wouldn't heal, his doctor finally told him that, you know, Dave, you can't do this anymore. You can't go out fishing like that because of the diabetes. And you know, it was very impactful to my grandfather, because this is what he lived for. This was his passion in his retirement years. And not only did his diabetes cut that short, but it also cut short our enjoyment and our time together up fly fishing. And to this day, I remember it like it was yesterday. I have the great memories of us fishing together, but unfortunately I also have the memories of what diabetes did to him and what it, quite frankly, did to us. There were two profound things that happened to me while I was in private practice for about 23 years in Idaho that really changed the way I practice now. The first one was just treating patients for usually spinal conditions and some neurologic conditions, and yet these patients also had diabetes. And what I was exposed to was patients who were, whether they had prediabetes and insulin resistance or full-blown diabetes, they were being, oftentimes the patients would talk about that their diabetic doctor was watching their condition or was managing it. And yet what I would see in these patients is that they were progressively getting worse. And it didn't make sense to me. It's like, why are we watching it? We're watching the prediabetes turn into diabetes. Why aren't we doing something? Why aren't we doing more for these patients? So I became very, very frustrated with the conventional medicine approach to watching and managing diabetes. Meanwhile, the patients are progressively getting worse. The second thing that happened during those years is I went to a continuing education medical conference, and it was a functional medicine conference. And for the first time, I heard doctors up there on the podium asking the question that I was asking, which is why? Why do these people have prediabetes? Why do they have insulin resistance? Why do they have diabetes? And if we can understand the why, then again, the treatment approach should be at trying to resolve the condition, not just watch it and not just manage it. And it literally was like the light bulb came on. And I knew when I left that conference that I had found the answer that would allow me to help these patients. And I literally went back and I started making arrangements to leave active practice so that I could go back to additional postgraduate training. I wanted to learn how to help people with diabetes, not just watch and manage their condition while they got progressively worse.